اتفضل يا محمود.
تمام. بسم الله الرحمن الرحيم. هنتكلم زي ما قلنا على الكي بوينتس for proper reporting of laryngeal carcinoma. Introduction. First, it is important to properly report criteria of laryngeal carcinoma and conclude its stage to determine the treatment route. The staging depends on the site of the lesion, its extension, associated lymph nodes, and the distant spread. As we can see, the staging of the glottic carcinoma on the right and the supraglottic carcinomas on the left, it is mainly suggested that we should write the proper extension because it determines the proper staging and therefore the proper treatment route. As you can see, the T1 staging is usually limited to the same site as in vocal cords. T2 shows extension to the supra or subglottic regions. T3 shows fixed vocal cords and minor thyroid cartilaginous erosions, and T4 usually involves extralaryngeal extensions. As for the nodal staging, it's also mainly supported by the number of seen lymph nodes and their site and size. And as we can see here, the treatment route really depends on the staging we concluded. Because in terms of T1 and T2 stages with no lymph nodes, it is usually supported by only radiotherapy. On T3, it is usually supported by radio and chemotherapy and then waiting for the response for other further evaluations. And an unfavorable T3 and T4, it is usually done by surgical total laryngectomy. The key items that we should always report on are the main site of the lesion, the extension of the lesion, other important points, and other notes we can see. The main site of the lesion is important to characterize. It's because it must know, first of all, the anatomy of the larynx. The larynx is subdivided into 3 regions. The supraglottic region, which basically extends from the base of the glottis down to the laryngeal ventricle, which is a space between the true and false vocal cords. The glottic region, which is basically the site confined only to the level of the true vocal cord. The subglottic region, which extends from the inferior aspect of the true vocal cord down to the cricoid cartilage. And we consider the regions that are involve more than one region as transglottic. As we can see in this image, the supraglottic region extends from the red line above to the green line below. The glottic region is from the green line to the blue line, and the subglottic is from the blue line to the black line. Next, we must talk about the extensions of the lesions. And the extension of the lesions is important, as we saw, for the proper staging and subsequent treatment route. In order to know the proper extension of the lesion, again, it is essential to know the proper anatomy. The extension should be commented upon on all sides of the lesion from the anterior, posterior, medial, lateral, superior, and inferior aspects, with each region showing different signs denoting the direction of extension. First, we talk about the anterior extension. At the glottic level, it may show extension of the lesion to involve the anterior commissure. At the supraglottic level, the signs of anterior extension include obliteration of the paraglottic fat, the pre-epiglottic fat, and involvement of the aryepiglottic folds. Any extralaryngeal extension should also be considered beyond when the lesion extends beyond the margin of the larynx. In the picture on the left side, we can see the normal anterior commissure and posterior commissure. And on the right side, we can see there is a mass lesion involving the anterior commissure. On the left picture, we can see the normal free paraglottic fat. And on the right side, we can see a mass lesion obliterating the right paraglottic fat. On the left image, we can see the normal aryepiglottic fold, paraglottic spaces, and pre-epiglottic space. And on the right image, we can see there is a thickening on the right aryepiglottic fold and invasion of the paraglottic space. In this image, you can see there is anterior extralaryngeal extension of the mass along with associated erosion of the thyroid lamina. Next, we comment on the posterior extension, which at the glottic level, it may show involvement of the posterior commissure. At the supraglottic level, we can see signs of posterior extension include obliteration of the piriform sinus. Extralaryngeal extension should include involvement of the posterior pharyngeal wall or the prevertebral muscles. Again, we can see the normal anterior and posterior commissure on the left side. On the right side, we can see a mass starting at the left vocal cord and extending into the posterior commissure seen by the curved black line. On the left side, we can see the normal piriform sinuses. And on the right side, we can see obliteration of the right piriform sinus by a mass malignant with associated malignant cervical lymph node. Next, we have the medial extensions, and we should conclude whether the mass is extending beyond the midline to the opposite side and involving the structure on the opposite side. In this image, we can see there is a left vocal cord mass extending through the midline and involving the right aspect of the right vocal cord. Next, we have the lateral extension, which include any extralaryngeal extensions when the lesion extends beyond the margin of the larynx. In this image, we can see a left vocal cord mass showing extralaryngeal extension along with destruction of the left thyroid lamina. Next, we have the superior and inferior extensions, which include the main extent of the lesion and the spaces that are involved from its superior to inferior limit. In this image, we can see there is a subglottic extension of a left glottic mass. Next, we should comment on other important points. We have to comment on the integrity of the laryngeal cartilage and whether there is erosion or sclerosis, which can sometimes be the only sign of extralaryngeal extension. We should never forget to comment on the lymph nodes and their size, levels, and presence of necrosis. As you can see in this image, there is a supraglottic mass with associated large necrotic lymph node. And in this image, we have the left glottic mass with associated sclerosis in the left thyroid lamina and the left cricoarytenoid joint. Other points to always consider is to check the scan part of the chest for any associated abnormality or metastatic lymph nodes. Check the scanned bones for any abnormal lesions and the thyroid gland for any abnormal nodules. Our staging is mainly done by CT. However, the role of MRI is usually to follow up on post-treatment to assess the response. Some applied cases. First case, we can see there is bilateral anterior true vocal cord thickening with mild enhancement extending to the anterior commissure. There is no extralaryngeal extension and normal thyroid lamina. Superiorly, we can see there are clear false vocal cords. And inferiorly, there is no subglottic extension. We concluded this is a picture of glottic carcinoma. Second case, we have an enhancing soft tissue mass involving the left true vocal cord along with the anterior commissure. The mass is seen extending to the right side, invading the right vocal cord. There is associated anterior extralaryngeal extension, erosion, and destruction of the thyroid lamina. We checked superiorly, there was clear vocal cords, false vocal cord, and inferiorly, it showed extension into the tumor into the subglottic space. There were a few associated enlarged cervical lymph nodes, as you can see on the left side. We concluded that this is a picture of transglottic carcinoma with associated extralaryngeal extension. Our third case, we start at supraglottic level this time. We have an enhancing soft tissue mass involving the base of the epiglottis, the left area epiglottic fold, the pre-epiglottic fat, and obliteration of the left piriform sinus. Inferiorly, it is seen involving the left true and false vocal cord and extending across the midline, possibly infiltrating the right side. seen obliterating the left paraglottic space and with associated extralaryngeal extension, and it is seen inseparable from the related left hyoid muscle. At the level of the glottis, we can see that it is invading the left true vocal cord and the anterior commissure. We can see there is associated sclerosis in the thyroid lamina and arytenoid cartilage on the left side. Further inferiorly, you can see that the subglottic space was free, but it was associated with few enlarged cervical lymph nodes. It was concluded that it was also a case of transglottic carcinoma with extralaryngeal extension. Thank you.
شكرا يا محمود.
شكرا جزيلا يا محمود، برزنتيشن جميلة جدا يعني.
شكرا لك.